I'm Trish Sauce. I'm an instructor here at Crescent City High School. I do the Allied Health Assisting program through the Health Sciences Academy. I'm excited because our program this year has been expanded to now we have Allied Health Assisting and Nursing Assistant. We are growing and we're being supported greatly by our principal, Michelle Hugginbotham. She's a great supporter of ours. Our kids go out into the community. Our partners are Life South Blood Bank, who we have worked with probably over 20 years now. And we also go up to Azalea Healthcare and Crescent City Kennel. We go to Lakewood Nursing Home and we go to Palaca Healthcare. In addition, we go to Family Urgent Care in Crescent City, and we go to Dr. Lowe, our local dentist office. Our partners are wonderful. They help us give opportunities to our students, and when our students are done, some of them will have their Certified Nursing Administrative Assistant credential, some of them will have their Certified Nursing Assistant credential, and some of them will have both.
The Allied Health program and the students that are in it here at Crescent City High are a huge help to us. These blood drives are practically their blood drives. I drop paperwork off and they just go out and they recruit and they do everything that they're supposed to, and we show up and stick people. That's pretty much it. So they handle everything, and it really shows them a professionalism on what a job and a career is going to expect of them. I mean, we've even went as far as hiring one of our students, or one of the students, to come and work for us after they've graduated. So with the great big help, we've been doing blood drives here for about 15 years now, and the students have helped save about 30,000 lives.
The Crescent City High School Allied Health program has really assisted us in many different ways. Gives the students an opportunity to see the documentation of pets, which includes birds, cats, and dogs. They understand the importance of cleanliness, documenting pet surroundings and environment, and also understanding that we also administer medications. We have to verify their vaccination records because animals do have diseases, and all that is applicable to birds, cats, and dogs.
We feel it's a real privilege to have the high school students from the Allied program come in and observe and let us train them a little bit on how to deal with the patients and do our vital signs and just observe them so they can be our future healthcare givers for people like myself. I think our patients really are real receptive to having them in here, knowing that we're training them for the future, so they never have a problem with the students observing or even doing their vital signs. They think it's a great program.
I started dental school when I was about 29. If I'd known more about it, I probably would have gone in earlier. I think the Allied Health program is very important because it gives you an idea of what goes on in a dental or a medical office before you have to actually go into some training. If you want to get into a program after high school, they look more at what you know about the field that you're going into. So experience in that field counts more for you than just about anything on your resume. In other words, they want to know that you know about dentistry before you become an assistant or a hygienist. And experience means an awful lot. I think by having high school students come in here in a relaxed atmosphere, they can have a chance to experience dentistry on a part that you don't normally see as a patient. You know, what does it entail? What would be your duties and the different auxiliaries that we employ here, or even as a dentist? So on that point, I think it's a priceless program. It gives you an idea of what the medical field is about, what your duties would be, and whether you would like it or not and want to pursue it in the future.
We appreciate our community partners and we hope to bring on more for next year. I was going over some some data from my previous classes, and I figured it up, and through our academy we've had about 130 CNAs come through here, about 30 certified medical administrative assistants. We've had 8 phlebotomists, and follow up on a lot of these students is that now we have 15 RNs, 4 BSNs, we have about 8 LPNs, we have 2 EMTs, we have 3 policemen, we have a rescue swimmer, paramedic, Navy person who came through our program. We have a pharmacy student who's going to graduate this year from FAMU with her pharmacy credential, and the list just goes on and on. I'm really, really happy to have this program here for them because it's a wonderful, wonderful opportunity because the kids can hit the ground with a credential. And in the past, we've had students that were able to start working while still in high school. I had a student last year who was able to go into work co-op and was working half a day in the afternoon and was going to school in the morning, and she was making $18 an hour while still in high school. So I'm just really, really proud of that.
The Allied Health Program is great because it allows our students to walk out of here certified and ready to enter the job field or to move into maybe getting an RN or an LPN, but it gives them that footwork and gives them the training to move forward into the health career. So really excited about that opportunity for them. Anything that we can do to prepare our students to move forward with success is something that we should just wholeheartedly support.
I think the Allied Health Program fits into high school because there are a lot of kids that are undecided about what they want to do. And when you say healthcare, they automatically think doctors and nurses. But there's like 500 different professions related to healthcare that are not doctors and nurses, and the things that the kids have not even thought of that they may want to go into. And this gives them an opportunity to discover it and to find out about it. So that fits in well. It gives them the opportunity for community service hours. To be a completer of my program, I require 100 hours of community service, and that goes with blood drive participation, working with the Rotary Club, working at the nursing home, all those kinds of things, because they need 100 hours to be eligible for Gold Seal and Bright Future scholarships. And so it fits in very, very well. We have students that can fill the need in our community. Our students get to know our community partners, and they get to know what's available in the community. A lot of them actually end up, because of their clinical experience, being hired as soon as they get their credentials. So I think it's a good thing for everybody involved.